coming to the histopathological features of squamous cell carcinoma. So it is usually graded as 3: well differentiated, moderately differentiated and poorly differentiated. So differentiated means based on the differentiation of the cells. So well differentiated. So there will be sheets and nest of cells with obvious origin from the squamous epithelium. So there will be connection from the squamous epithelium which these sheets and nest are formed. And large cells with distinct cell membrane and hyperchromatic nucleus, that is dysplastic features will be present. Increased and atypical mitotic figures but not numerous. And the most prominent feature in well differentiated is the individual cell keratinization and epithelial or keratin pearl formation. And few malignant cells will be invading the connective tissue from the break of the basement membrane, usually in an irregular pattern. And prognosis is usually better for this differentiation. So A means you can see there will be single cell keratinization, and B, these are the epithelial pearls or the keratin pearls, and there will be a obvious connection from the epithelium and the breakage of the cells into the underlying connective tissue. These can be seen in the well differentiated variant. So as the differentiation progresses, all the features will get lost somewhat. So in moderately differentiated, there will be intermediate level of cellular differentiation and the cells will be less organized and mature and when compared to the normal cells. Then poorly differentiated, here the cells will not have little resemblance or no resemblance to the cell of origin. That is, we cannot identify them as squamous cells. And they are usually seen as rapidly dividing primitive cells. There will be no differentiation. That is why the name poorly differentiated. And there will be numerous increased and atypical mitotic figures and fail to form keratin. That is, the function is not fulfilled. That is why there is no differentiation. And the cells have lack of cohesiveness and extremely irregular pattern of infiltration. So it is also otherwise termed as anaplastic or high-grade lesion or high-grade carcinoma. And there will be increased regional metastasis. And some of the more aggressive nature are if they involve the nerve, that is perineural spread, or lymphatic invasion and tumor extension beyond the lymphatic capsule. So these are the aggressive nature of the tumor. And broader as grade squamous cell carcinoma into 4. The grade 1 is less than 25% of undifferentiated cells. That is, the cells will be having, they can perform their function. Grade 2, that is 25 to 50% will be undifferentiated cells. And grade 3, that is 50 to 75% undifferentiated. And finally grade 4, that is more than 75% undifferentiated cells. So cells cannot be identified easily. And coming to the metastasis in oral squamous cell carcinoma. So the most common locations are the submaxillary, superficial and deep cervical nodes. So cervical nodes are the usual metastasis. And there is a terminology known as skip metastasis. As the name suggests, the carcinoma cells spread to the regional lymph node, but that are not immediately adjacent to them. They will usually skip the first node and jump to the next node. That is known as the skip metastasis. And bloodstream metastasis is usually uncommon in case of squamous cell carcinoma.
Download Blulins now, redefining quality education.